Hey agents, this is Luis Moreno here with Simply Health Insurance Agency. All right, I've already shared some hot off the news, hot off the press news, which is DACA are soon going to be eligible for ACA. They're saying 100,000 people will soon be eligible. This is huge for us agents who sell ACA. I'm going to get into some specifics about DACA, exactly what it is, and we'll get into the CMS news bulletin that came out about that, and then we'll talk about the opportunity. All right, so check this out. Oh, but before I do that, you got to like this video, you got to give me some comments, and please make sure you subscribe and you're sharing me out there to your colleagues. Please help me grow this channel. All right, so let's go take a look at what DACA is. DACA stands for Deferred Action for Childhood/Arrivals. Okay, that's what it stands for. What is it really? Okay, they got the nickname the Dreamers. I've been around a lot of people that are DACA, never really heard the word Dreamers, but anyway, they're using that. And what it is these are people who arrived into the US as children. Okay, so if they're given DACA, then this policy allows them to avoid deportation because their parents are here illegally, but it gives them the ability to not be deported. They can secure a work permit, a social security number, and a driver's license, which enables them to live and work here in the US openly and legally. Each DACA approval is valid for 2 years. It can be renewed, providing ongoing protection and employment opportunities. So it's a really good thing. We've had this for as long as I can remember, okay? Now, it's not citizenship. It's not giving them a green card, okay? So it's just allowing them, it's just giving them the ability to stay here and function without being worried about being deported, okay? That's all that DACA is. Now, here are some of the benefits that they get. Number one, protection from deportation. They can work authorization. They can legally work. In fact, I hired a young girl. She started with me, was with me a couple of years after she graduated from college. Then she went on and did what went to go study. But while she was here working for me, she was DACA. I hired her. It was legally. There were no issues. She was even insurance licensed. So again, why they couldn't get ACA plans in the past, I really couldn't tell you why, but it's coming soon. All right, they'll have access to education. So they'll get a social security number, driver's license, access to healthcare. Right now, they are not eligible. Okay, now they can get work or they can get insurance through their work. If their employer provides them a group plan, they can enroll. Okay, so protection of the status, which means they never get classified as having an unlawful presence. It's renewable every 2 years. It allows them a path to other immigration relief down the road. Okay, so this is as of 2020. Now we're 4 years later, but there were 1.8 million people eligible for DACA. Okay. Okay, so all good. So here are some of the requirements. Entered the US unlawfully prior to their 16th birthday. Okay. They lived continuously in the US since January 15, 2007. They were under the age of 31 on June 15, 2012. Were physically present in the US on June 15, 2012, and at that time of making the request for consideration for deferred action with the US Citizenship and Immigration Services. Had no unlawful status on June 15th, have completed a high school or GED or an honorable discharge from the armed forces, and have not been convicted of a felony. So those are the requirements, okay? So just know that at their DACA, right now, we can't do anything for them, but in the future, we can. Now, let's go look at the CMS ruling that came out in May of 2024. So on this ruling, they're saying that they're publishing a final rule to modify the definition of lawfully present, okay? So DACA recipients will no longer be excluded from a health plan because they're going to be considered lawfully present, okay? So, and all this is going to go into effect on November the 1st, 2024, okay? Now, we go in there and we start insuring them, okay? The earliest that they're going to get coverage is 12/1. So November the 1, it goes, the provision, whatever this is, goes into force. So November the 1st, we can enroll people into, we can do applications for people in November. The only issue is that their start dates are going to be 12/1. Okay, so the earliest they can have their marketplace coverage will be December the 1st, 2024. Okay, so not bad. This came out in the paper a couple of days ago. Biden administration says 100,000 new migrants are expected to enroll in ACA Obamacare next year. 100,000 new people. Guys, what an opportunity to help these people with their health care. So, along with everything else that we can market to and everything and all these people that we have access to, now we can help this group of people. So if you're not doing ACA, guys, I highly encourage you to do it. As an insurance agent, you want to have multiple lines of income. ACA is great, right? It's great income. Here's the kind of income I'm telling you. Now I'm going to lowball this. It can be higher, but every 100 heads will make you about $24,000 a year minimum. Okay. If you have 400 heads, you're talking almost 100 or more than $100,000 a year, talking $10,000 a month in income with just 400 heads. It's huge, guys, huge opportunity. And that's just the beginning. These people are going to need dental and vision policies. They're going to need hospital indemnity policies. They're going to need life insurance policies. And if you're like me and also have a P&C agency, you're going to be able to offer auto and home. So lots of opportunities. Now, if you want to get into the game, you're like, oh, I want to do this. How do I do it? Get a hold of me. I'll send you contracting. If you've got Medicare contracts over there, life insurance contracts over there, that's fine. We're not going to mess with those. You want to move those over to us? Great, we'll help you. But the ACA contracts are independent of those life contracts and those Medicare contracts. Okay, so if you're interested and want to get into the ACA game, let me know. I would love to help you out. Not only will I get you set up for contracting, but after you get contracting done, then I will train you. I have a platform called School, and on that platform, we put all of our agents. We're 700 plus strong right now. Okay, on that platform is where you get the Zoom training links that I do for ACA and Medicare. And also, it's a great platform for you to research past questions and also answer and put new questions there that you need help with in reference to ACA and Medicare. So again, my email's down below. I got lots of goodies down there, guys. I've got my ACA 101 course. If you're already with another organization and you want to stay with them, but you need training, you can buy my course. Secondly, I've got my agent CRM. Okay, that is the go-to CRM in the industry. You're going to want to get them. So you got agent CRM, and then you're also going to get, if you want to learn how to market on social media, Facebook ads. That's the best way to go. Okay. I use them exclusively. I run ads on there. I had a lady named Shauna who helped me set mine up. And then between me and her, and mostly her, she came up with a course to help you guys market on social media. And it's a good course. I told her, I helped her design it for agents in mind because I'm an agent like you guys. All right. So should be very, very good if you want to learn how to market on social media. And on top of that, okay, on top of all that, I add a little something to that course, and that is how to take those leads and plug them into your CRM, the agent CRM, and make it work for you, warm them up, and even call you when those leads are imported into the system automatically. So a lot of goodies, guys. Click on that one, and please do me a favor, comment, like, and subscribe to my channel. Thank you, guys.